So Local Care in North Kent is an initiative I'm really excited about. We're investing quite heavily as an NHS over the next couple of years, and that's 2.6 million in Swale and 4.2 million in Dartford, Gravesham and Swanley, to really boost up our services to enable us to look after people in their own homes and within their own communities. And what we're hoping by doing this is that we can support people when they're becoming ill and look after them in a better way so that they can stay in their own home. But on the other hand, if they do need to go into hospital, we can get them home sooner and more safely. And that really is what we're calling local care. For these initial stages of the local care plan, we're really focusing on our people with complex health needs and also those who are frail and elderly. And the aim is really to keep them well for as long as possible in their own homes. For the first time in my working memory, actually we're all working together, so it's not just the GPs and the district nurses and the traditional primary healthcare team, but it's also social services. We've got new roles such as community navigators, and we're all working together to support our population in our communities. So we've got a number of things that are happening as we roll this programme out. First of all, GP practices are being encouraged to work together in geographical clusters to make it more sensible and to build up that community resilience. As part of that, we're working together in multidisciplinary teams, and those really are where we get together as a whole partnership and we discuss people that we're concerned about. So some new people that are part of our primary care teams are community navigators, and these are people who are also funded jointly by Kent County Council, and these are really acting as the linchpins to help people navigate the health service and the social services. So one of the other initiatives we have is a paramedic-led home visiting service to our housebound patients, and this service is enabling people who are becoming ill to be seen much more quickly than they might have been traditionally by their own GP. This service is already making a difference, so people who are becoming ill are being seen earlier in the day and therefore being attended to before they get more ill, but it's also helping GPs with their workload. So another big part of the work we're doing is to increase our rapid response service, and this is just a team of nurses who can actually respond very quickly to people who are becoming ill in their own home, but in addition to that can actually help people who are in hospital come home again more quickly. Because we all know that nobody wants to be in hospital any longer than is absolutely necessary, and patients and people get better more quickly when they're in their own environments. And we're committed to delivering the best possible care for our patients. So as a GP, what I really like about this local care programme is the way that we're beginning to work in a very different way, and I'm seeing changes that are making a benefit to people at home, and that's what my job is about.